I am someone who is always in my mind planning. So as you see, I've got another one on these on my another one of these on my face, because that was the intention. Leave the hospital, come home, do a face mask, because the skin won't take care of itself. Now, the reason I use that in the intro is because when I was at the hospital earlier, I didn't go yesterday because I was ill, and knowing my sister, I figured I tried to call the hospital, but no one answered the phone, which is typical. So, come visiting time, she might have been, she's familiar with me coming every evening. So she might have been waiting for me and waiting and waiting, and I didn't show up, and that's not my style. So I made sure I got there at to be there as soon as visiting time started, so she wasn't sitting there wondering whether or lying there rather, wondering whether or not I was going to come. So anyway, when there was a real, actually today was like good nurse, bad nurse, and so my first introduction was to good nurse because they've moved my sister to another bay, so she wasn't the nurse I met as I was coming in, the one who opened the door for me. She was good enough to let me know without me having to ask that my sister had been moved to a different bay, same ward, different bay. So it's a different setup. So normally I sit sort of to her, I don't know my left from my right. I sit to her left, but this time I was sitting to her right, which is better. The way it's set up, it's actually better. It's better for socializing. So there was a really nice nurse from Africa, and some of them are not nice, but this one, she said, "Oh, your sisters, you're the younger sister," and I don't know how it came up, but she asked my age or something, and I said to her, "I'm 54," and she goes, "Really?" She's 50, and she said something about needing to lose weight. So usually I always make the joke, to deflect. I make the joke that my surname is Young, because sometimes people in the vicinity can, they hear things, and they, to be honest, people like to size people up, and I get a lot of this. So yeah, my surname's Young, and yeah, I look young for my age, kind of thing. No big deal. But in this situation, this particular nurse, she was, she was all right about it, and kind of, obviously I'm not overweight. She was very overweight. And she said, "Oh, I need to lose weight." But I can't tell you how many times people say that to me. I want to lose weight. Like I said, I'm constantly planning what I'm going to do, which is why I'm wearing this, because I'm going to keep it on until bedtime, which won't be until about 1 o'clock in the morning. So I've got another at least another 3 hours before I need to wash this off, so it'll get the job done. So like I said, so people will say to me, "Oh, I need to lose weight," but it's like, talk is cheap. So there was a time when people would say that to me, and I'll say, "Yeah, I can help you, this, that, the other." But I've stopped saying that now because I realize, as said, talk is cheap. I need to see some action. So I mean, she's really nice, to the extent, very, very nice lady, to the extent that I thought, I would like to help her, if to, even if she's not serious, but maybe I can help to motivate her or something. But it didn't get to that point because there was another nurse there, a Jamaican nurse, and like I said, good nurse, bad nurse, and she started off okay to begin with, and then I think I was speaking to my sister in Jamaican, which is the native, it's my first language, kind of. We speak to one another in Jamaican patois. So obviously she's Jamaican as well, so she could understand everything that I was saying, because I speak somewhat fluently. And as I said, sometimes people size you up. So, cutting a long story short, she tried to pull rank on me, which is the wrong thing to do. That's not a good thing to do, because I don't respect rank. So I've been there nearly an hour. Let's be generous and say 45 minutes. And she asked from across the room, where's my mask? So I said, I don't wear one. And why not? And this is the bit. Now, I have issues with breathing. I wasn't born with them. It's something that developed. I have an idea why it developed, but it's not anything to go into. And, at first when I used to experience the issues, it was one of these things where it's like, oh, God, help me. And then gradually, because I'm that kind of person, I find ways of managing the situation. Like, for example, the other day I was talking to one of my friends and I got into a bit of difficulty and I managed to sort it out and he didn't even realize, because I said I've found ways to manage it without needing to go to a doctor. So she says to me, where's your certification from the doctor? You don't say things like this to me. I don't do doctors. If I've got issues with breathing and I know that I've got issues with breathing and I've found a way to manage it, why do I need a doctor to tell me that I've got issues with breathing and then to provide me with some form of medication that I don't need, because obviously I'm managing without it? So my thinking is, let's say the health service goes down and people are so dependent on doctors to provide them with medication. Say there is someone in the situation that I'm in who's got issues with breathing, but they're used to relying on the doctors for medication. What if that person can't get the medication? What's going to happen? I'm not going to have any problems because I never relied on the doctor in the first place. So I think it's pretty, like I said, I'm not the kind of person you pull rank with, because I don't respect rank. My life is my life and it is up to me to manage it in the best way that I'm able to. And if the best ways that I know how isn't good enough, then it is for me to go away and find the information or get the inspiration in order to be able to then take it to the next level. With regards to my breathing issues, I'm not going to have any kind of certification from the doctors because it's nothing to do with the doctors, right? So it's this thing where everything we rely on the doctor. Doctor knows best. I've just finished speaking to my mother. Now, it's been 15 days since my sister's been in the hospital, and as of yet, I've not met the doctor. I've not spoken to the doctor. But the doctor, it's a he, I know this because my mother told me. The doctor has spoken to my mother on the phone. Now, my mother is the weeping type of person, the feelings and emotion type, and she gets worried and upset and all of that. So she informed me that she was on the phone and she was crying and he was telling her, oh, don't worry, we're looking after her being my sister. Now, I happen to think that people, this is my opinion, I happen to think that people who want to save the world, want to save lives, these types of people, that they have a touch of narcissism, they have God complex. Don't get me wrong, this one nurse, the one that says she wants to lose weight, to me, she comes across as somebody who wanted to be a nurse because she cares about people, which is different. It's not, because in her attitude, you could see she had a fantastic bedside manner, the way she was talking to the patients, whereas the other one, the Jamaican one, she was just striding in, and then she tried to flex her muscles with me. Wrong move. Right, so it's the same thing. So I said to my mother when she said, oh, the doctor was saying, oh, never mind, we're looking after her, blah, blah, blah. I said, yeah, he would say that to you, but he's not going to speak to me because I'm not that kind of person. And the way you respond to him, or the way you come across to him, you're actually feeding him. You're feeding his ego. whereas I don't do that with people. I don't feed anybody's egos. So you know, my mother's learning a lot. She was actually on the phone at the time when I was having this interaction with the Jamaican nurse, who as well, she when she didn't get any joy with the mask, she then asked me, no, she said to me, you can only stay for an hour. Visiting hours is for 2 hours, 6 till 8. I've been doing the 6 to 8 thing for the past, ever since my sister's been in. So apart from the fact I didn't go yesterday, every day I've been going the same hours, and nobody said, oh, you're only supposed to be here for 1 hour. But this one pulled rank and tried to tell me I'm only there for 1 hour. So on that principle, I decided I even if I felt inclined to leave after an hour, even if I had to leave after an hour because I had to do something, I was going to stay for 2 hours. So that's what I did. And in the meantime, she was in and out of the ward, not a word, didn't even look at me. Right, so this is an example of the power and control that we give to people just because we respect their titles. I don't respect anybody's title. And I was saying to one of my friends, I was speaking to her, she called me while I was at the hospital, and I said I would call her when I leave. True to my word, I called her. So I was giving her the breakdown on that. And I said to her, it's exactly the same thing with racism. Racism is when, you know, whether it be racism against black people, racism against white people, any kind of ism, it's where people come with their credentials. So in the case of racism, it's my skin is better than your skin. Good for you. I don't respect anybody's skin, right? And the only time I think about my skin is when I'm doing this, right? My skin doesn't play any role in my life. If your skin is of importance to you, good for you. The same with education. Good for you if it means something to you. It doesn't mean anything to me. The only thing that means something to me is what means something to me. So it's sort of like these are lessons that you know, we could have a better life. We could have better life experiences if we didn't feel that we need to bow down to people. Like when all of you lot, whoever you are, were out there clapping and banging your pots for these medical professionals. I didn't. I was looking out of my window, looking at you doing it, right? Because as far as I'm concerned, like, ooh, let me show you. Here's one I made earlier. This is the cushion that I was supposed to make the other night. Right, so that's the back. But something came up. Right, so I'm making 5 of these. I've got 2 more to go. Right, I don't need anybody to clap and bang pots for me because I make nice cushions and curtains and blinds. It's my job and it's what I get paid for doing. So I don't have much more than that to say because I've said plenty. But this thing with the nurse demanding, where's your mask? Yes, I have breathing problems even if I don't wear it on my sleeve. And no, I'm never going to have any kind of certification from a doctor because I don't do doctors. My health is my health, and it's up to me to find ways of managing it. And on that note, I'll see you later.